Thank you very much for joining us for Denver 7 News at 5. I'm Shannon Ogden.
And I'm Jessica Porter. We want to jump straight into the latest numbers from the Colorado Department of Public Health and Environment. We sailed past the 3,000 mark today with 3,342 confirmed cases of COVID-19 here in our state. And we're starting to see hospital beds fill up. 620 people are dealing with symptoms severe enough to be hospitalized. Tragically, 80 people have now passed away from the virus in our state. And the state is tracking outbreaks at 17 long-term care facilities that house some of our most vulnerable Coloradans.
And we're also tracking the trajectory of the spread. Take a look at this graph that shows new cases day over day in Colorado. And as testing ramps up, we are seeing our biggest jump so far, 376 new cases today. That's the curve we're trying to flatten by staying home as much as possible. So on average right now, every person who gets coronavirus in our state infects 3 or 4 other people. So that's why staying home is so very important right now. The goal is to get that transmission number to as close to 0 as possible. But as we have warned, experts say things are projected to get worse here in Colorado before they get better.
Governor Jared Polis's team is projecting the state will hit its COVID-19 peak sometime in the next several weeks, and it is working quickly to add space and supplies.
Denver 7's Megan Lopez shows us what that looks like.
Even after Coloradans stop shaking hands with strangers or going to the office or hanging out with their friends, even after the state issued a stay-at-home order, even as many of us are doing our part in this pandemic, an unfortunate reality.
We will see a surge that may overwhelm our hospitals sometime between April and July of 2020.
Things are going to get worse, not a matter of if, but when. So in a press conference Wednesday, Governor Polis and his team laid out their strategy to expand hospital space.
So we have set some wildly important goals.
The goal is a 4-tier system. The worst patients would be in critical care hospitals. Tier 2 would be freestanding ERs or critical access hospitals for severe patients. Tier 3 would be for those who need care but not constant attention.
This is where we're looking at larger facilities, arenas, convention centers, stadiums, even warehouses.
A scene that could be similar to the triage set up in Central Park. And Tier 4 would be for non-serious patients who just need a place to quarantine, like the homeless. But that's only part of the answer.
What we know now is not only are we facing a healthcare crisis, we're also facing a supply chain crisis.
The state is now working directly with suppliers. Governor Polis was even considering sending a plane to China in search of medical equipment.
We didn't have to do that. We've placed a number of purchase orders. And we have a number of supplies that are in transit.
But that fragile new supply relationship comes with a stark warning.
This might be April Fool's Day, but Colorado isn't going to be anybody's fool. We want to verify that the masks work and are not counterfeit before we pay for them.
For now, the state is doing everything it can to prepare.
At this point in the crisis, personal protection equipment equals lives.
Knowing the worst is yet to come. Megan Lopez, Denver 7.